If you're over 50 and you've been waking up in the middle of the night with excruciating leg cramps that feel like someone is twisting your muscles into knots, then what I'm about to share with you will absolutely change your life. And I've been an orthopedic surgeon for over 25 years. I've seen thousands of patients walk through my office doors, and I can tell you with absolute certainty that what I discovered about leg cramps in seniors completely shocked me to my core. Just last week, I had a 72-year-old patient named Margaret who came into my office with tears in her eyes. She told me she hadn't had a full night's sleep in over 8 months because of severe leg cramps that would wake her up 3 to 4 times every single night. She said the pain was so intense that she would literally scream, waking up her husband, who would frantically massage her legs until the cramping subsided. Margaret had tried everything her family doctor suggested: drinking more water, eating bananas, taking over-the-counter pain medications, but nothing worked. But here's what shocked me the most. After running some simple blood tests, I discovered that Margaret had a severe deficiency in one specific vitamin that most doctors completely overlook when treating leg cramps in seniors. Within just 30 days of addressing this deficiency with the right approach, Margaret called me crying again. But this time, they were tears of joy. She told me she had slept through the entire night for 7 consecutive nights without a single cramp. Now, before we dive deeper into what this powerful vitamin is and exactly how you can use it safely to rebuild your leg muscles and stop those torturous nighttime cramps, I want you to understand something crucial. Every single person is different, and what I'm sharing with you today is educational information based on my clinical experience and current medical research. You should always consult with your personal physician before making any changes to your health routine, especially if you're taking medications or have underlying health conditions. But I can promise you this. By the end of this presentation, you'll understand exactly why your leg cramps are happening, what this game-changing vitamin is, how to use it safely and effectively. And I'll give you a complete 30-day plan that has helped hundreds of my patients regain their mobility, sleep peacefully through the night, and feel confident walking again without fear of sudden, debilitating cramps. You'll also discover 3 warning signs of this vitamin deficiency that show up specifically at night, signs that most people completely ignore, thinking they're just normal parts of aging. Spoiler alert, they're not normal. And they don't have to be your reality. Now, I know what some of you might be thinking. Another doctor promising a miracle cure with just one vitamin? I get it. I was skeptical too. But when I started looking at the research and seeing the results in my own practice, I couldn't ignore the evidence any longer. The truth is, this isn't about taking a magic pill and hoping for the best. This is about understanding the complex relationship between muscle function, nerve health, and this specific vitamin that becomes increasingly difficult for our bodies to produce and absorb as we age. So let me start by introducing myself properly. I'm Dr. Michael Harrison, and I've dedicated my career to helping people over 60 maintain their independence and mobility. I've performed thousands of surgeries, from hip replacements to spinal fusions. But what I've learned over the years is that surgery should always be the last resort. My passion lies in helping seniors prevent mobility problems before they become severe enough to require surgical intervention. Throughout my career, I've specialized in age-related mobility issues, and I've seen firsthand how devastating leg cramps can be for seniors. They're not just painful, they're dangerous. When you're afraid to get up at night because you might get a cramp that sends you tumbling to the floor, when you stop taking evening walks because you're terrified of cramping up in public, when you avoid social activities because you never know when these painful episodes might strike, that's when leg cramps stop being just a minor inconvenience and become a serious, threat to your quality of life and independence. My goal today is to help you understand how to strengthen your legs, eliminate those painful cramps, improve your balance, and maintain your autonomy well into your golden years. But before we get to the solution, we need to understand exactly what's happening in your body when you experience these leg cramps. Now let's talk about what's really happening when you get those excruciating leg cramps. A muscle cramp is essentially an involuntary contraction of your muscle that occurs due to what we call neuromuscular hyperexcitability. In simple terms, your nerves are sending mixed signals to your muscles, causing them to contract forcefully and refuse to relax. The most common types of leg cramps that I see in my senior patients are nocturnal cramps in the calf muscles. These typically happen in the middle of the night when you're trying to sleep. You might also experience cramps during walking, especially if you've been more active than usual or after physical exertion, even something as simple as gardening or cleaning the house. But here's what most people don't realize about the true impact of these leg cramps. Yes, they're incredibly painful, but the real danger lies in how they affect your overall health and well-being. First, they severely disrupt your sleep patterns. When you're waking up multiple times every night screaming in pain, you're not getting the restorative sleep your body desperately needs. This leads to daytime fatigue, memory problems, weakened immune function, and increased risk of depression and anxiety. Second, these cramps create a fear of movement and activity. I've had patients tell me they've stopped taking their evening medications because they're afraid to walk to the bathroom in the dark. They avoid exercise altogether because they're terrified of triggering a cramp. This fear leads to a sedentary lifestyle, which actually makes the problem worse by causing muscle weakness and poor circulation. Third, and perhaps most dangerously, these cramps significantly increase your risk of falls. When a severe cramp hits suddenly while you're walking, your natural reaction is to grab onto something for support or to fall to the ground. I've seen too many seniors end up in my operating room with broken hips or fractured wrists because a leg cramp caused them to fall. So what's actually causing these leg cramps? There are several contributing factors, and understanding them is crucial to addressing the problem effectively. The most common cause I see is dehydration combined with electrolyte imbalances. As we age, our kidneys become less efficient at maintaining proper fluid balance, and many seniors don't drink enough water throughout the day because they're worried about frequent trips to the bathroom, especially at night. Another major factor is sedentary behavior. When you don't use your muscles regularly, they become weak and more prone to cramping. This is particularly problematic for seniors who have become less active due to other health issues or simply because they've retired and are no longer walking as much as they used to during their working years. Sarcopenia, which is the age-related loss of muscle mass and strength, plays a huge role in leg cramps. Starting around age 30, we begin losing muscle mass at a rate of 3 to 8% per decade, and this loss accelerates after age 60. When your muscles become smaller and weaker, they're much more likely to cramp up during normal activities. Vascular issues like varicose veins can also contribute to leg cramps. When blood flow to your muscles is compromised, they don't receive adequate oxygen and nutrients, making them more susceptible to cramping. Peripheral neuropathy, which is nerve damage often associated with diabetes, can cause abnormal nerve signals that trigger muscle cramps. Several medical conditions commonly seen in seniors can increase the likelihood of leg cramps. Hypothyroidism slows down your metabolism and can affect muscle function. Diabetes not only can cause nerve damage, but also affects circulation and healing. Spinal compression, which becomes more common as we age due to arthritis and disc degeneration, can interfere with the nerve signals that control your leg muscles. But here's something that might surprise you. Many medications that are commonly prescribed to seniors can actually make leg cramps worse. Diuretics, which are used to treat high blood pressure and heart conditions, can cause dehydration and electrolyte imbalances. Statins, which are prescribed to lower cholesterol, are well known for causing muscle pain and cramping in some people. Certain bronchodilators used for respiratory conditions and some antidepressants can also increase the risk of muscle cramps. Now, I want you to take a moment and think about your own experience with leg cramps. Do you find that you get cramps more often at night? Do they typically occur in your calf muscles? How many times per week would you say you experience these painful episodes? I encourage you to really think about this because understanding your personal pattern of cramping is important for developing an effective treatment strategy. Here's where things get really interesting and where I had my shocking discovery. After years of treating seniors with leg cramps using the conventional approaches, hydration, electrolyte replacement, stretching exercises, I started noticing that many of my patients weren't getting the relief they deserved. So I began digging deeper into the research, looking at factors that might be commonly overlooked. That's when I discovered the profound connection between leg cramps in seniors and a deficiency in one specific vitamin. The vitamin I'm talking about is vitamin D3. And I'm going to explain exactly why this vitamin is so crucial for muscle function and how a deficiency can be the hidden cause behind your persistent leg cramps. Vitamin D3 is often called the sunshine vitamin because our bodies produce it when our skin is exposed to sunlight. But what many people don't realize is that vitamin D3 is actually a hormone, not just a vitamin. And it has receptors throughout your entire body, including in your muscle tissues. Here's what happens when vitamin D3 interacts with your muscles. Vitamin D receptors are found in skeletal muscle fibers, and when these receptors are activated by adequate levels of vitamin D3, they help regulate calcium transport within the muscle cells. Calcium is absolutely essential for proper muscle contraction and relaxation. When you don't have enough vitamin D3, this calcium regulation becomes disrupted, leading to muscles that contract too easily and have difficulty relaxing, which is exactly what happens during a cramp. But there's more. Research has shown that adequate vitamin D3 levels are crucial for maintaining muscle strength, particularly in the proximal muscles, which include the muscles in your thighs and hips. When seniors have adequate vitamin D3 levels, they show significant improvements in muscle strength and a reduced risk of falls. This isn't just about preventing cramps. It's about maintaining overall leg strength and stability. The problem is that vitamin D3 deficiency is incredibly common in seniors, and there are several reasons why this happens. First, as we age, our skin becomes less efficient at producing vitamin D3 when exposed to sunlight. A 70-year-old skin produces only about 25% of the vitamin D3 that a 20-year-old skin produces from the same amount of sun exposure. Second, many seniors spend less time outdoors than they did when they were younger. Whether it's due to mobility limitations, concern about skin cancer, or simply lifestyle changes, reduced sun exposure means less natural vitamin D3 production. Third, the dietary sources of vitamin D3 are limited, and many seniors don't consume adequate amounts. While fatty fish like salmon and mackerel are excellent sources, not everyone enjoys eating fish regularly, and other food sources like fortified milk and cereals don't provide very high amounts. Fourth, absorption issues become more common with age. The kidneys, which play a crucial role in converting vitamin D3 into its active form, become less efficient over time. Additionally, certain medications commonly used by seniors can interfere with vitamin D3 absorption and metabolism. So, how can you tell if you might be deficient in vitamin D3? There are several signs and symptoms that are often overlooked or attributed to normal aging, but they could actually be indicators of vitamin D3 deficiency. The most obvious ones are muscle pain and weakness, particularly in the legs and hips. If you find yourself having difficulty climbing stairs, getting up from a chair, or feeling like your legs are weak and wobbly, this could be related to low vitamin D3 levels. Chronic fatigue is another common sign. If you're getting adequate sleep but still feeling tired throughout the day, vitamin D3 deficiency could be a contributing factor. Frequent falls or a feeling of being unsteady on your feet can also be related to the muscle weakness associated with low vitamin D3 levels. And of course, frequent muscle cramps, especially at night, can be a key indicator of vitamin D3 deficiency. But here are 3 specific nighttime signs that most people completely ignore, thinking they're just normal parts of getting older. The first sign is restless legs. You know that feeling where your legs feel uncomfortable and you have an irresistible urge to move them, especially when you're lying down trying to sleep. This can be related to vitamin D3 deficiency affecting nerve and muscle function. The second sign is cold feet that seem to get worse at night. While there can be circulation-related causes for cold extremities, vitamin D3 deficiency can affect blood flow and make this problem worse. The third sign is difficulty falling asleep or staying asleep due to leg discomfort. Even if you're not experiencing full-blown cramps, that general itchiness or restless feeling in your legs that keeps you tossing and turning could be your body's way of telling you that your vitamin D3 levels are too low. Now, here's where it gets exciting. Once we understand that vitamin D3 deficiency could be the hidden culprit behind your leg cramps, we can take action to address it safely and effectively. The first step is getting the right test done. You want to ask your doctor for a 25-hydroxyvitamin D test, also written as 25-OHD. This test measures the storage form of vitamin D3 in your body and gives us the most accurate picture of your vitamin D status. The optimal range for this test is somewhat controversial among medical professionals, but most experts now recommend levels between 30 and 50 nanograms per milliliter. Some functional medicine practitioners prefer levels on the higher end of this range, around 40 to 50 nanograms per milliliter, for optimal muscle and bone health. If your levels are below 30 nanograms per milliliter, you're considered deficient, and if you're experiencing leg cramps along with other symptoms I've mentioned, addressing this deficiency should be a top priority. Now, let's talk about how to safely supplement with vitamin D3. The maintenance dose that works well for many adults is between 1,000 and 2,000 international units per day. However, if you're deficient, you might need a higher dose initially to get your levels up, followed by a maintenance dose. Here's something important that most people don't know about taking vitamin D3. You should always take it with a meal that contains some fat. Vitamin D3 is fat-soluble, which means it needs dietary fat to be properly absorbed. Taking it on an empty stomach or with a fat-free meal will significantly reduce how much your body actually absorbs. But here's where my protocol gets really powerful. Vitamin D3 doesn't work alone. There are several other nutrients that work synergistically with vitamin D3 to optimize muscle function and prevent cramps. Magnesium is absolutely crucial. Magnesium is involved in over 300 enzymatic reactions in your body, including those involved in muscle contraction and relaxation. Many seniors are deficient in magnesium, and this deficiency can contribute to muscle cramps even when vitamin D3 levels are adequate. I typically recommend between 200 and 400 milligrams of magnesium per day, preferably in the form of magnesium glycinate, which is well absorbed and less likely to cause digestive upset. Vitamin K2 is another important cofactor. K2 helps ensure that calcium goes where it's supposed to go, into your bones and teeth, rather than being deposited in soft tissues like your arteries. When you're taking vitamin D3, which increases calcium absorption, you want to make sure that calcium is being utilized properly. A dose of 90 to 120 micrograms of K2 per day is typically appropriate. Rather than taking calcium supplements, which can sometimes contribute to cramping if not balanced with other nutrients, I prefer that my patients get their calcium from dietary sources like dairy products, leafy greens, and sardines with bones. These food sources provide calcium along with other nutrients that help with absorption and utilization. Now, let's talk about safe sun exposure as part of your vitamin D3 strategy. While supplementation is important, especially during winter months, getting some natural sunlight can also help boost your vitamin D3 levels. The key is smart sun exposure. 10 to 20 minutes of midday sun on your arms and legs without sunscreen can stimulate significant vitamin D3 production. Fair-skinned individuals might need less time, while those with darker skin might need a bit more. The important thing is to avoid burning. You want to get just enough sun exposure to stimulate vitamin D3 production without damaging your skin. During the summer months, this might mean going outside in the late morning or early afternoon when the sun is strong enough to trigger vitamin D3 synthesis, but not so intense that you'll burn quickly. However, there are certain groups of people who need to be more cautious with vitamin D3 supplementation, and it's important that we address these precautions. If you have a history of calcium kidney stones, you should work closely with your physician before starting vitamin D3 supplementation, as increased calcium absorption could potentially contribute to stone formation in susceptible individuals. People with sarcoidosis, a condition that causes inflammation in various organs, can have problems with vitamin D3 metabolism and may develop dangerously high calcium levels. If you have this condition, vitamin D3 supplementation should only be done under close medical supervision. Hyperparathyroidism is another condition where caution is needed. The parathyroid glands regulate calcium levels in your body, and if they're overactive, adding vitamin D3 supplementation could lead to excessive calcium levels. If you're taking anticoagulant medications like warfarin, you need to be careful with vitamin K2 supplementation, as it can affect blood clotting. This doesn't mean you can't take it, but you'll need to work with your doctor to monitor your INR levels and possibly adjust your medication dose. Certain anticonvulsant medications can interfere with vitamin D3 metabolism, and long-term use of corticosteroids can affect how your body processes vitamin D3. If you're taking any of these medications, you'll want to discuss vitamin D3 supplementation with your prescribing physician. People with significant kidney disease need special consideration because the kidneys play a crucial role in activating vitamin D3. In advanced kidney disease, a special form of activated vitamin D3 might be needed instead of regular supplementation. Now let me address some of the most common errors and myths I hear about treating leg cramps, because understanding what doesn't work is just as important as knowing what does work. The first myth is that leg cramps are simply a hydration problem, and drinking more water will solve everything. While dehydration can certainly contribute to muscle cramps, it's rarely the only factor, especially in seniors. I've seen patients who are well hydrated but still experience frequent cramps because they have underlying nutrient deficiencies or muscle weakness issues. The second myth is that eating bananas will cure leg cramps because they contain potassium. While potassium is important for muscle function, focusing solely on potassium while ignoring other crucial nutrients like magnesium, vitamin D3, and calcium is like trying to bake a cake with only one ingredient. The banana myth has probably prevented more people from finding real relief than any other piece of advice out there. Another dangerous myth is that taking high doses of vitamins will work faster. This is particularly problematic with vitamin D3 because taking too much can lead to toxicity, causing nausea, vomiting, weakness, and serious kidney problems. More is not always better, and working with proper dosing based on blood levels is crucial for both safety and effectiveness. I also frequently hear the myth that vitamin D3 supplementation causes weight gain. This concern stems from confusion about how vitamin D3 works. Vitamin D3 is a hormone that helps regulate many bodily functions, including metabolism. Optimizing your vitamin D3 levels is more likely to help your body function better overall rather than cause weight gain. Any temporary changes in weight are usually related to improved muscle mass and better hydration status. Now let me share with you my comprehensive 30-day anti-cramp plan that has helped hundreds of my patients achieve relief from their leg cramps and rebuild their leg strength. Week 1 is all about establishing the foundation. This is when you'll start your vitamin D3 supplementation at the appropriate maintenance dose based on your current levels and body weight. You'll also focus on optimizing your hydration by drinking 30 to 35 milliliters of water per kilogram of body weight throughout the day. For most people, this works out to about 8 to 10 glasses of water daily. But you want to spread this out evenly rather than drinking large amounts at once. If you don't have medical restrictions on sodium intake, you'll want to ensure you're getting adequate salt to help your body maintain proper electrolyte balance. This doesn't mean adding table salt to everything, but rather ensuring you're not overly restricting sodium if you've been told to follow a low-salt diet without medical necessity. During the first week, you'll also begin a gentle evening routine of stretching your calf muscles, hamstrings, and the muscles in the front of your shins. Hold each stretch for 30 to 45 seconds and repeat 2 to 3 times. The key is gentle, sustained stretching, not bouncing or forcing the stretch. You'll also implement good sleep hygiene practices specifically designed to prevent nighttime cramps. This includes warming your feet and calves before getting into bed, either with a warm bath, heating pad, or simply by wearing light socks to maintain warmth throughout the night. Week 2 builds on the foundation from week 1. You'll continue with your vitamin D3 supplementation and hydration routine, but now you'll add specific strengthening exercises for your calf muscles. Calf raises are simple but incredibly effective. Stand behind a chair or next to a counter for support. Rise up on your toes. Hold for 2 seconds, then slowly lower back down. Start with 2 sets of 10 repetitions, 3 times per week. You'll also begin a daily walking routine. Even 10 to 20 minutes of walking can significantly improve circulation to your leg muscles and help prevent cramps. If you haven't been walking regularly, start slowly and gradually increase your distance and pace as you feel comfortable. Week 3 introduces more comprehensive leg strengthening exercises. You'll add sit-to-stand exercises from a chair, which are excellent for building strength in your quadriceps and glutes. Start by sitting in a chair with your arms crossed over your chest. Then stand up using only your leg muscles and slowly sit back down. This exercise mimics movements you do every day and builds functional strength. You'll also begin doing bridge exercises on your bed or on the floor if you're comfortable getting down and up. Lie on your back with your knees bent and feet flat. Then lift your hips up by squeezing your glutes and pushing through your heels. Hold for 2 seconds, then lower slowly. This exercise strengthens your glutes and hamstrings, which are important for overall leg stability. Balance exercises become important in week 3 as well. Standing next to a kitchen counter or sturdy table. Practice standing on one foot for 10 to 30 seconds. Then switch to the other foot. This helps improve proprioception, which is your body's awareness of where it is in space, and can help prevent falls. Week 4 is about assessment and fine-tuning. You'll review your progress over the past month, noting changes in the frequency and intensity of your leg cramps, improvements in leg strength, and overall sleep quality. This is also when you should consider getting your 25-OHD levels rechecked if possible, to see how your supplementation is affecting your vitamin D3 status. You'll also use week 4 to adjust your hydration and electrolyte intake based on your activity level and the season. During hot weather, or if you've increased your exercise routine, you might need to increase your fluid intake and pay more attention to replacing electrolytes. Throughout all 4 weeks, it's important to keep a simple journal tracking your cramps. Note when they occur, which muscles are affected, how long they last, and what you were doing before they happened. This information can help you identify patterns and triggers that you might not have noticed otherwise. Now let's talk about what to do when you're actually experiencing a leg cramp, because despite our best prevention efforts, you might still occasionally get one, especially in the early stages of implementing this plan. The most effective immediate treatment for a calf cramp is dorsiflexion of your foot. This means pulling your toes back toward your shin, which stretches the cramping calf muscle. If you can't reach your foot with your hands, try pushing your foot against a wall or the footboard of your bed to create the same stretching effect. For a standing calf stretch, face a wall and place your hands against it. Then step your affected leg back about 3 feet while keeping that heel on the ground. Lean forward against the wall, which will stretch your calf muscle and often provide immediate relief. Once the acute cramping subsides, apply firm massage to the affected muscle combined with gentle heat. A warm washcloth, heating pad on low setting, or warm bath can help relax the muscle and improve blood flow. Continue the massage for 5 to 10 minutes to help prevent the cramp from returning. If you've been sweating excessively due to hot weather or increased activity, gentle electrolyte replacement might be helpful. This doesn't mean chugging sports drinks, which are often high in sugar and unnecessary additives. Instead, try adding a pinch of sea salt to a glass of water, or consider a low-sugar electrolyte supplement. I want to take a moment here to ask you to reflect on your own experience with vitamin D3. Have you ever had your vitamin D levels tested? If so, do you remember what your last result was? How do you typically feel during the winter months compared to summer? Do you notice that your energy levels, mood, or muscle comfort change with the seasons? These are all clues that can help you understand whether vitamin D3 deficiency might be contributing to your leg cramps. If you've never had your vitamin D levels tested, I strongly encourage you to ask your doctor about this at your next appointment. It's a simple blood test that can provide valuable information about your health status and help guide your supplementation strategy. Now let me share with you some specific exercises that are particularly beneficial for seniors who want to build leg strength and prevent cramps. These exercises are designed to be safe and effective, focusing on functional movements that will help you in your daily activities. The first exercise is the seated marching exercise. Sit in a sturdy chair with your feet flat on the floor and your back straight. Lift one knee up as high as comfortable. Hold for 2 seconds, then lower it slowly. Alternate legs for a total of 20 repetitions. This exercise helps strengthen your hip flexors and improves circulation to your legs. Standing heel-to-toe walking is excellent for balance and leg strength. Place one foot directly in front of the other, heel-to-toe, and walk forward in a straight line for 10 steps. Use a wall or counter for support if needed. This exercise challenges your balance and strengthens the small stabilizing muscles in your legs and feet. Wall push-ups are great for overall leg stability. Stand arm's length from a wall. Place your palms flat against it at shoulder height. Then lean forward and push back. This exercise engages your leg muscles to maintain stability while also providing upper body strengthening. Ankle circles and calf stretches should be done daily. While seated, lift one foot off the ground and rotate your ankle slowly in both directions 10 times. Then, extend your leg and pull your toes back toward your shin for a calf stretch, holding for 30 seconds. The frequency and intensity of these exercises should be tailored to your current fitness level. If you're just starting out, aim for 3 sessions per week with light intensity, focusing on proper form rather than speed or resistance. As you get stronger, you can gradually increase to 5 sessions per week and add light resistance using resistance bands or light weights. Proper footwear is crucial for preventing leg cramps and maintaining stability. Look for shoes with a firm sole that doesn't compress easily when you press on it. The heel counter, which is the back part of the shoe that cups your heel, should be sturdy and not collapse when you push on it. Avoid shoes that are too flat or have excessive cushioning, as these can contribute to instability. If you have foot problems like flat feet or high arches, custom or over-the-counter arch supports might be beneficial. However, any changes to your footwear should be made gradually to allow your muscles to adapt. Nutrition plays a crucial role in muscle health and cramp prevention. Adequate protein intake becomes increasingly important as we age to prevent muscle loss. Most seniors should aim for about 1 to 1.2 grams of protein per kilogram of body weight per day. This might be higher than what you're currently eating, so focus on including a protein source at each meal. Good sources of dietary magnesium include dark leafy greens like spinach and kale, legumes such as black beans and lentils, nuts and seeds, and yogurt. Potassium-rich foods include not just bananas, but also sweet potatoes, avocados, white beans, and salmon. Hydration should be distributed throughout the day rather than trying to drink large amounts at once. Start your day with a glass of water. Have water with each meal, and sip water throughout the day. Limit alcohol intake, especially in the evening, as alcohol can interfere with sleep quality and contribute to dehydration. However, there are certain warning signs that indicate you need immediate medical attention rather than trying to manage your leg cramps on your own. If you experience pain, warmth, redness, and swelling in one calf, but not the other, this could be a sign of a blood clot, which is a medical emergency. Don't try to massage or stretch what you think might be a cramp if these other symptoms are present. Progressive muscle weakness, unexplained weight loss, fever, or persistent night pain that's different from typical cramp pain could indicate a more serious underlying condition that needs medical evaluation. Recent falls, especially if accompanied by back pain that radiates into your legs or causes numbness or tingling, might indicate spinal problems that require professional assessment. Let me address some frequently asked questions that I get from my patients about this approach to treating leg cramps. One of the most common questions is about statin medications and muscle cramps. If you're taking a statin drug for cholesterol management and experiencing muscle pain or cramps, it's important to discuss this with your prescribing physician. Don't stop taking your medication on your own, but do ask about checking your vitamin D3 and magnesium levels, as optimizing these nutrients sometimes helps reduce statin-related muscle symptoms. Another frequent question is whether dietary sources of nutrients are better than supplements. While I always prefer that people get their nutrients from food when possible, the reality is that it's very difficult to get adequate vitamin D3 from diet alone, especially for seniors. A combination approach, getting what you can from food and supplementing the rest, is usually the most practical strategy. People often ask about quinine for leg cramps, sometimes found in tonic water or available as a prescription. The medical consensus is that the risks of quinine generally outweigh the benefits for most people. Side effects can include heart rhythm abnormalities and low blood platelet counts. The small amount in tonic water is unlikely to be effective for cramp prevention. Now, as we wrap up today's presentation, I want you to think about which strategy you're going to implement tonight. Are you going to start with a gentle stretching routine before bed? Will you focus on warming your feet and calves before getting into bed? Are you planning to increase your water intake tomorrow? Or are you ready to talk to your doctor about getting your vitamin D3 levels tested? The key to success with this approach is consistency and patience. You didn't develop vitamin D3 deficiency overnight, and you won't reverse it overnight either. But if you follow the plan I've outlined, most of my patients start noticing improvements in their sleep quality and reduction in cramp frequency within the first 2 weeks. Let me summarize the core concepts we've covered today. The central idea is that correcting vitamin D3 deficiency, combined with the right lifestyle habits, can significantly reduce leg cramps and help rebuild leg muscle strength in seniors. The practical steps are simple. Get tested to know your current vitamin D3 status, supplement safely with the right dose and cofactors, maintain proper hydration, incorporate gentle stretching and strengthening exercises, and follow up with repeat testing in 4 to 8 weeks to assess your progress. This isn't just about stopping leg cramps, although that's certainly a wonderful benefit. This is about maintaining your independence, sleeping peacefully, moving confidently, and enjoying your golden years without the fear and pain of debilitating muscle cramps. Remember, every person is unique, and what works for one person might need to be modified for another. The key is working with your healthcare provider to develop a personalized approach that takes into account your specific health conditions, medications, and individual needs. Your health is your most valuable asset, and investing in understanding and optimizing your vitamin D3 status is one of the best investments you can make for your long-term mobility and quality of life. If you found this information helpful and want to continue learning about safe, effective strategies for maintaining your health and mobility as you age, I encourage you to continue educating yourself about evidence-based approaches to healthy aging. Knowledge truly is power when it comes to taking charge of your health. Thank you for taking the time to learn about this important topic. I hope that what I've shared today gives you hope that your leg cramps don't have to be something you just live with. With the right approach, you can take control of your muscle health and get back to sleeping peacefully and moving confidently. Remember, you deserve to live your best life at any age, and that includes being free from the pain and disruption of frequent leg cramps. Take the first step today, whether that's scheduling an appointment with your doctor to discuss vitamin D3 testing, or simply starting with some gentle stretching tonight before bed. Your journey to stronger legs and peaceful sleep starts now. You have the knowledge, you have the tools, and most importantly, you have the power to make positive changes in your health. Don't let another night of painful cramps rob you of your rest and your confidence. Take action today and start experiencing the relief and freedom that comes with healthy, strong leg muscles. The path to freedom from leg cramps is clear, and you now have everything you need to start walking that path. Your future self will thank you for taking this important step toward better health and greater independence. Sweet dreams and strong legs await you.